having bulldogs. So, doctor, explain to us again, why is it that this system?
So basically, with the K laser, you don't end up with as much bleeding. Well, you don't end up with any bleeding, to be honest, because the laser will cut and cauterize at the same time, and they tend to do, a lot better without so much bleeding in the back of the throat. So yeah, that's why I prefer to use the laser.
I'm not sure if I'm correct about this. Without K laser, you've got to put stitches in that irritates the throat, and I believe they have to be on some type of omeprazole or something about a week before a surgery normally.
So even with the K laser, they still have to be on omeprazole a week before.
And what's the reason for that?
Because brachycephalic dogs tend to regurgitate when they're under anesthetic. So regardless of what the surgery is, if we're going to be putting a brachycephalic dog under GA, it's good practice for them to have omeprazole for a week before.
And what is the job of omeprazole?
So,
why that drug specifically?
So the omeprazole basically helps to reduce the acidity, and it basically prevents damage from regurgitation. So it's a proton pump inhibitor, and yeah, it just basically prevents any aspiration and damage from the stomach acids when they regurgitate.
And that's a lovely bit of cut that we have there. It's quite a big flap.
Yeah. So that's some stuff
So
there.
some people would say, well, why didn't we simply tell the owners not to feed their dogs 24 hours before?
So even if they're starved, like all brachycephalics should be starved before surgery. If they starve for far too long and they haven't had any omeprazole or anything like that, it basically then causes their gastric contents to become even more acidic. And basically it's the acidity that's the problem, right? When you're dealing with the brachy.
I mean, the opportunity that you've created here is incredible.
Can we put this down? If we unscrew those and close his mouth.
And I assume you're going to do his nose as well?
Yes, I'm going to do his nose now.
And again, all the blood vessels are cauterized, so you get no bleeding.
Yes.
This is remarkable. So now you're using the same K laser technology, basically to create a incision to increase the circumference of the nose. Is that correct?
So basically what we're doing here is called a nair resection, all right? So we're basically resecting a part of the nostril so that the nostril hole can be bigger to allow more air in and allow them to breathe better.
And that's why a lot of times with bulldogs, when they haven't had this operation, you can see that their tongue gets blue a lot when they're doing exercise. And it's almost like they are deprived of oxygen. Hopefully, this is going to improve the ability to breathe.
Yeah.
Now we've got the flap off. Let's see how this looks. That's an incredible difference. And when we see that, it's remarkable. Wow.
It's a nice big breathing hole.
That's going to be incredible for him. Doctor, well done. Nurse, how's everything going?
Really well, really good. Anesthetics are stable, been on his fluids, and yeah, really good. Had his pain relief, ready for recovery.
Noah's Ark Veterinary Clinic, bringing the most modern technology to veterinary medicine in the United Kingdom with our 24-hour ambulance service.